The pollution crisis in the national capital does not stop. Even before Diwali, after Diwali, we've been witnessing a bad air quality, and continuously we have been noticing that the pollution levels are not going down. But it has severe health risks. Already there are studies that says that polluting environments reduce your life expectancy as well. And now the pollution levels can also affect a woman's womb. And to tell us more about this, I have with me Dr. Jayashree Sundar, who is a gynecologist at the Madhukar Rainbow Hospital in New Delhi. Ma'am, how does the pollution level affect a woman's reproductive system?
If we see, we women are born with a fixed reserve of eggs, right? It's not that you keep multiplying your eggs as you grow older. So obviously, the amount of pollutants that we are now inhaling and we are consuming in us, like if it's the nitric oxide, the carbon monoxide, the PM 2.5, they all have effects at the cellular level, obviously, and that is helping in the degradation of cells. Like now we are seeing that women are having premature ovarian failure, and that has definitely gone up. So we used to read that menopause age is between the age of 45 to 55, but what we are now seeing is that women are menopausing earlier, or when they are thinking that, oh, I'm ready for a baby at 37, 38, we check that their egg reserve is very low. And even if they have a good egg reserve and they are not able to have fertility, and we tell them to go for assisted fertility, we see that the quality of eggs, that we are not able to fertilize the eggs even when we take them out, right? That is why you see the number of fertility clinics that are booming in this country, right? We didn't need so much assistance. We are a 140 crore population, right? We didn't need so much of assistance for fertility. Obviously, there are many genuine conditions which need fertility assistance, but one of the reasons is the degradation of eggs. And also, we should not forget our men, We are seeing that the sperm number or the quality of sperm, the motility of the sperms have also gone down. And we say that the fragmentation of sperms has increased. I mean, we are not getting good quality sperms when we are looking at men. So definitely fertility has become a challenge. It is affecting the womb of a woman. I'm not getting into cancers at all, because cancers have multiple other factors. And also we are seeing that miscarriages has gone up. So you might ask me to put a number, how many miscarriages happen. But obviously, since we are not very good with statistics, but definitely there is a rise. In fact, even after a fertility treatment, after having an IVF, we are seeing a rising incidence of miscarriages.
Do you directly correlate this with the pollution levels? Because for the last decade at least, there has been a pollution crisis surrounding the northern Indian region. And do you consider that polluting particles PM 2.5 or PM 10 or nitric oxide, as you mentioned, are contributing directly to a rise in women losing children to miscarriages?
I think so. When we find, so there are certain reasons for miscarriages, right? And we are many a times have girls. Recently I delivered somebody who had 5 miscarriages without any reason. All the investigations were absolutely okay, but the 6th time I could manage to deliver her baby. But even that baby stopped growing after a certain point in time. So not only the risk in miscarriages, we are also seeing that we are having babies who are not attaining their weight potential or the growth potential, and suddenly we find that they are not growing to the extent they should be growing. So what implications it has on the mental development and the physical development of that child? We need a definite, we have been talking about it, that we need to do a long-term follow-up on babies who are not growing the way they should inside the womb. And the other thing that we see recently is there is a rise in autism in our country also. Though it is not directly related, there has been no corroboration, but definitely we are seeing a rise in autism which has got no genetic role, right? So what is the reason for the rise in autism? So all this is happening more in the urban population, and obviously we are seeing it much more in Delhi. So we really need to be, so talking about it just during these 2 months is not going to help us a lot. All of us have to contribute as much as we can in whatever small way we want. So running away from the problem. I mean, people say when they come to me, oh, हम तो बच्चों को बाहर भेज देंगे, यहाँ रह के फायदा नहीं है. So is it not going to happen there in 100 years if the same population is going to do the same thing there, right? So all of us have a moral obligation to work towards it, and more so for the next generation that we are producing, because children are standing at a lesser level than us, and obviously the pollutants that they are taking in is much more than what we are taking in, and they are taking it at an age when their cells are multiplying, right? So obviously the changes in the cells will be much more, the implications much more, and how it is going to affect their fertility potential, their growth potential, their exposure to carcinogens is even think about it is a big nightmare. So I do think there has been a definite change in the reproductive potential of the woman, and one of the contributory factors is definitely the pollutants that we are inhaling continuously.
Well, this is extremely worrying because we know that pollution severely impacts the lungs. We know that the pollution has been impacting our upper and lower respiratory tracts, but now if doctors are saying that it is leading to miscarriages in women, and especially concerns related to the reproductive organs of women, it's definitely a very big concern that needs addressal. And of course, we need to live in clean environments to actually give birth to future generations as well. With Premchandra Mishra in New Delhi, Milan Sharma for India Today.